Thanks, Bob. All right. Well, good morning, and thank you for having me here today. I was telling Bob before we started, I've got 3 kids. They're 12, 10, and 8. And we like to have breakfast together. We like to have our Cheerios together. And I was telling them what I was doing today, and I said I was going to talk to this big group of people, and you know, bigger even than the classes that I normally teach. And my 10-year-old says to me, he's like, "Dad, make sure you use your big boy voice." And so I said, "Okay, Chris, I'll use my big boy voice. But if you are having any trouble hearing me, please just do this, and I will try to use my big boy voice so that everyone can hear." So now I have to get serious, because today we have a serious topic to talk about. And like Bob said, my background is as a nurse. My work was with people who are homeless. And it's through that work that I found my passion. It was through working with so many people who were struggling, who were broken, who were hurting, who were trying and who were failing, that I really wanted to find a way to create a bigger change. It's not that I didn't love working there as a nurse. It's not that I didn't want to help people anymore, but it's that I wanted to do more and I wanted to look bigger. And when I looked around at the issue of homelessness, I really didn't see a lot of people in our country and in other countries like ours who were asking the bigger questions of what's happening? How did we get here? Why are folks ending up homeless in the first place? And so that's how I've crafted my program of research, is to look at the higher level issues. What's happening in our systems, in our policies, in our histories, in people's lives that is creating this situation in the first place, and what can we do about it? So my goal this morning is to take you on a little bit of a journey, because I think we need to start from where we've been before we get to where we are and talk about where we hope to go. And so I want to start with the history, and it's always interesting as someone who entered academia fairly young to teach history to a people of more experience than yourself. And so if I get the history wrong, I'm joining you for lunch and you can correct me. If there's anything that I miss or I miss out, or I leave out, or so please do let me know. So here's the history as I've read about it. All right, so homelessness has always existed, but it's looked different over time. So the homelessness that we experience today looks different than we've had in the past in Canada. And there's some pivotal moments that have crafted that. And that's what we want to talk about, because that starts to give us clues about what we can do in the future. So before 1970s, homelessness was very much tied to poverty. And it was connected with issues like alcoholism and precarious work and drifting and traveling the rails. And so every major urban area had a space where groups of individuals who maybe were temporarily in the community or maybe had broken apart from their families would go and they would live and they would stay, and these would be what we would call now a slum. And so every city in Canada had its sort of slum housing. In London, it was down near what's Carling Heights now, at the tracks just past Adelaide. And this would be kind of cobbled together housing where people would live, and it wouldn't be particularly safe or particularly healthy, but it would offer some place that people could just go and they could crash. And so because of that, street homelessness, as we see and experience it today, wasn't as prevalent. Now, you would still have individuals, particularly around alcoholism, who might be more publicly and visibly homeless. But again, many of them would retreat to the slums and places to stay. And so because of that, you do have some people who say, well, homelessness never existed because I don't remember seeing it when I was younger. But it was there, it was just more hidden away into these slums, these communities where people could go. However, we had an important moment in history through the 50s, the 60s, that set the framework for the 70s. And this was the real progressive social turn in Canada that happened after World War II. And so because of the trauma and the challenges of World War II, Canada as a country started to look about, well, how can we live safer and healthier together? So how can we ensure that no one in our societies are left behind? And so you have all sorts of important things that happened through that generation, like our public health care system in the 1960s. And it's that idea that every Canadian should have their basic needs met. You should be able to get health care regardless of whether you can afford it or not. And so part of the conversation at that time, through the 50s into the 60s, was a conversation about housing. And so as they had this conversation about, well, what does every person deserve, they started to look to the slums and say, we don't think this is it. We don't think this is good enough. And so you have the start of building codes, right? So I think we're all probably familiar with building codes today. And those were built at, or created at that same period of time to say, it's not good enough in Canada for people to have bad housing. Your housing shouldn't make you unsafe. And so they created a plan to then get rid of the slums and other types of unsafe dwellings. But they were thoughtful about that. And they said, well, if we're getting rid of the slums, where are all these people going to live, who that's their home at the moment? And so they said, well, we need to build social housing. And so they did all sorts of reviews of what they called skid rows or the slums to see who's living there, how many people are living there, and how much housing do we need to build for people who don't have any money currently or are in crisis, where they can go, they can be safe at least in their buildings. And so that was the framework in the 60s that led to the 1970s, where you have your, what I call the social housing boom. And so this was development across Canada of social housing for people who were experiencing poverty, homelessness, mental illness, addictions, that they would be guaranteed a place where they could live. And so a number of these buildings are buildings that you will see or may be familiar with around London, places like 580 Dundas, like Walnut Street, 241 Simcoe, McNay. These are buildings that were all built at that time. And so they all kind of look a bit the same as well, because they all had the same kind of architectural understanding behind them. And so the idea was that for everyone who needs a house, we will build more social housing. And so they built over 100,000 social housing units across Canada in that period of time. So that's the 1970s. Towards the end of the 70s, we start to hit a recession. Economy starts to decline, and we have a significant political turn. So in the 1980s, we have the Reagan, the Mulroney, the Thatcher era. And at that time, as all of those countries faced recession, the prevailing economic understanding of the right was, in times of recession, governments need to spend less because there's less money around, so we will spend less money. And so they started to withdraw those social programs. It's an interesting time because actually our economic theory has quite flipped on that. And we'll get to that when we talk about the current situation around housing. But at the time, it was like in periods of recession, the government spends less, and so they stopped dead building any new social housing. Put the brakes on, no more. And actually in London, we didn't have any new social housing built from the start of the 1980s until 1995, when you had some charitable organizations starting to build some of their own, some church groups, for example, building their own social housing. So the government just said, we're not doing this anymore. And so by the 1980s, at the end of the 80s, you start to have governments putting out reports about, what's this homelessness thing? We're suddenly seeing all sorts of reports from the towns, the cities, the neighborhoods in our country that they are seeing people who are homeless. And so again, this wasn't just a Canada thing, this was across the developed world, where they started to say there's this growing crisis of homelessness. And so actually the United Nations in 1987 declared this is the International Year of Shelter for the Homeless, because oh my goodness, we have this new growing homelessness thing happening. And it looked different. It looked different from before the 70s. It looked different from during the 70s, where everyone who was homeless was given a social housing unit. There's this new thing that was happening. So then in the late 80s and into the 1990s, our communities become concerned. We suddenly have folks on the street. We don't remember having folks on the street. And we want to do something good about that. And so you have the development of food banks. Food banks in Canada started in 1989. And those, again, were a response to this new crisis we are seeing around poverty, food insecurity, around housing. And you had the start of the development of emergency shelters. And that response is a good human feeling. Right? So I think it's great that we as our communities saw this homelessness and said we need to do something. We need to give people a place to stay. And so we put our money in. We donated to the Salvation Army and Mission Services of London and Unity Project so that they could build their emergency shelters. That becomes a bit of a challenge, and we'll get to that in a second. So you have, through the 90s, 400 new emergency shelters built across Canada. By today, we now have 1,086 emergency shelters across Canada with 28,495 beds for people who are homeless. 145,000 people approximately in Canada use those emergency shelters in any given year, being a total nights stayed of over 5 million bed nights of people staying in shelter. You can see some trends on that. The bottom graph here are children who are using emergency shelter. You see an obvious trend of more children entering emergency shelter. So that was a response. That's how we as societies, as neighbors, decided to help out, was to create this emergency shelter system. So I mentioned this creates a little bit of a challenge, and here's the problem. The problem is emergency shelters are better and safer than people sleeping on the street, sleeping outside, sleeping in tents, sleeping in the woods. Better and safer than that, but they're not that good and safe. So what we see is that the longer you're in emergency shelter, your health declines fairly rapidly, and your mortality, so risk of death, goes up very significantly. Your risk of, if you're a woman, being engaged into the sex trade goes up. Your risk across the board of using drugs goes up significantly, especially for youth. Most youth have not used any hard drugs prior to entering shelter. After a year, almost 100% of youth in emergency shelter have used drugs. So you get this situation where emergency shelter is a good charitable response, but it's a somewhat mediocre solution, right? So I don't want to hear me saying bad things about shelters, because we will always need a crisis place for people to land, but we don't want that to be their permanent housing, right? So the idea is get people into shelter so that they're safe, and then get them home, wherever home will be, whether that's where home was or whether that's where home is now. It's to get people home. And so men who are chronic users of shelter, their chance of survival to 75 is only 32%. Women is a little bit higher, because women are healthy and strong and live longer, right, women? But it's still only 60%. They did a study, this is a stat out of Toronto, where they looked at an average age of death for, I think this was a male population they were looking at, who were staying in emergency shelter, was 47 years old, average age of death for men in shelter. 6 times increase in suicide amongst women who are staying in shelter. So again, shelter is a great crisis response. It's a terrible place to live long term. So, what does this look like in London? So I've given you some Canada-wide stats. I want to zoom us down to our own community and give us a picture of what's going on here. So we have 330 emergency shelter beds in London. Our occupancy runs at about 85%. Now that occupancy's gone up a little bit again. It was declining, but this year we've been running a bit over 90% capacity. It's an important part of our story because this helps us understand that every community is a little bit different. Because if you read the news, you've probably seen what Toronto's been going through, and they have shelter occupancy rates of like 110%. And they're just really in a crisis of like, where are these crisis spaces for people to go? In London, fortunately, we don't have that problem. And so people may be turned away from emergency shelter, but it's not usually for a capacity situation. Usually it's because something else is going on. The good news story is this table on the right, which shows us unique individuals staying in shelter. So we have actually gone from 2011 with 3,400 down to 3,200, 3,100, 2,800, 2,600. So we actually have less unique individuals who are coming into our emergency shelters in London. Good news story. Two of the challenges are those who are coming are getting younger. So that's that bottom chart there. And that goes from 2011 to 2015, and the table on the left there are those 17 or younger. So you can see that our shelters are serving more children and youth, even though the numbers are going down. And the other issue, which isn't represented in that, is that length of stay. So what we're finding is less people are coming into the shelter, but those who are staying in shelters, a third of those are staying long-term. And we just talked about why staying long-term in shelter is not a great solution. So that's what the little chart on the left here talks about, that 2/3 are less than a month that people stay, but there's that 1/3 who are staying longer and longer and longer in shelter. Those are individuals with very unique, challenging, complex lives and situations. So overall, actually, we are seeing some good progress, but we do have particular populations who are stuck, who we're not seeing that same progress with. The other thing I wanted to mention is that those are the stats from emergency shelter, and emergency shelter isn't the whole story of homelessness. So there's a lot of what we call hidden homelessness, and hidden homelessness might be people who are crashing on a couch. They might be folks who have found an abandoned building where they can stay. They might be women who are trading sex for a place to stay. They might be people who are involved in the drug trade and someone up the chain is letting them stay in a place. They're people whose housing is not safe, permanent, stable, but they don't necessarily show up in our statistics. So I wanted to mention that because the number of 2,000 may not be the full number. There might be a bigger number there once we count in all of those who are hidden as well. So those are statistics on where people are staying. I wanted to start to paint a little bit of a bigger picture because homelessness isn't just about housing. Homelessness is intricately linked to issues of poverty, food security, safety. And so one of the things I wanted to point to you is like, what's the status of social housing now? So I told you in the 70s, we built all this new social housing. In the 80s, we stopped. Currently, the wait list for social housing in London is 3,200 family units, households, including individuals, but also multi-person households. So you can imagine when you stop building new social housing, more people will experience a homelessness crisis, and you start to get this backlog. And that backlog grows and grows, and people get stuck in shelter. And people are stuck waiting for social housing, which we've started to build again, but we've got this big backlog to get through. The other picture I wanted to paint for you is the reality of poverty in our community. And so social assistance is our way of ensuring that everyone in London has some level of income. So if you're in crisis, you lose your job and you don't have EI, or your EI runs out, or you're a woman who has left an abusive partner and you have no source of income, or you're a youth who is just out on their own, you can get social assistance. That social assistance breaks down on $384 for your shelter, $330 for basic needs, $54 for the trailing benefit, and $23 for HST credit, giving you not a lot of money to live in for a month. They've been increasing that a little bit. Again, if you watch the news, you'll have seen, 4%, 2%, 5% increases. So we've tipped over the $700 a month. $700 a month is not a lot to live on in our community, particularly because of our housing costs. So the real costs of shelter in London are, our average bachelor apartment is $621 a month, average one-bedroom apartment $802 a month. So what we're doing is that we're giving people not enough money to pay rent. Therefore, they remain homeless, right? So we're making a choice in how we're designing our social assistance that people will be homeless because they can't afford a place. So you've got this couple of $100 gap. We'll talk a little bit about how some organizations are helping to bridge that gap, but that gap is very real, and that gap is a problem for people finding home. So those are statistics, but I wanted to talk about people because that's what we're talking about today. We're talking about human beings. And I wanted to warn you that this is a difficult story. They're all difficult stories. There's no cheerful story about how people become unhoused. And so I wanted to tell you about Cheryl. Cheryl is a real Londoner. Cheryl is someone who I've had a chance to work with. I've changed her name. I've changed some aspects of this story, but this is a real story. Cheryl and her husband were from Ontario originally. He got a job with fabric making industry, and the business for fabrics in Canada is in Montreal, because that's where all the awesome clothes are, apparently. So they moved to Montreal, and they started to have a family. And that was a little bit hard for Cheryl. Her family was all back here. Her parents were here. So they felt a little bit, she felt a little bit isolated, but she wanted her husband's career to be great. And the kids were growing older. They had 2 kids, and things started to go bad with her and her husband. And so as part of his work, he was very much becoming kind of a social part of this community. And a big social aspect of the work that he was doing was going out, and he would drink a lot. And when he was drinking, he was angry. And when he was angry, he started to push her and grab her and hit her and hurt her. And so this went on actually for about 8 months of this drinking and the violence. And then Cheryl said, that's it, we're getting out of here. And she took the kids, she got Greyhound, and they came back west to the places she knew. Now, unfortunately, her parents at that time had already relocated. They went south to Florida, which being this winter, maybe more of us should consider for a long-term plan. But they were gone. And so when she came back to what was her home community, she was still isolated. And she had these 2 kids, and she didn't want her husband to know where she was, so she didn't know how to get access to the income that he would owe her as part of family support. So she landed here with nothing. And so she went to the social assistance office, and they said, great, you can start to get money for you and your 2 children. You qualify for $1,060 a month for you and your 2 children to find a place and to feed them and to get them around, get them into school, get them new clothes, all those sorts of things. So of course, she ended up at the shelter because you can't just find a 1 or a 2 bedroom apartment in London for $10.50. And so she ended up in the emergency shelter for families, and she's very thankful for what they were able to do. They were able to support her, at least keep her safe, get her connected with resources, get her kids supported so that they could get back into school and get transportation. But what she told me was that the biggest challenge she had when she went to leave the shelter was that once she did find a place that she could at least afford, she was basically going to have no money left. And so for her, she was thinking about, how do I feed my family, right? And so she was really looking at this trade-off between, do I stay in the shelter where at least I can get food, or do I get out into housing where I don't know how I'm going to be able to afford to feed my kids? Now she did get out of the shelter, and she is housed, and her kids are housed, and was able to use some of the legal supports here so that she could get access to the income that she is entitled to from her partner. So that's just one story, but there's so many stories of these sorts of crises, these sorts of terrible events that put people in a very difficult situation. So when we think about what causes homelessness, and actually that's the other thing that my kids asked me this morning. My one son said, so why do people become homeless? And I said, well, it's complicated, but it's crisis. It's because bad things happen to people. Often people do bad things to each other, and it leads to people not having a place to stay. And so relationship breakdown is a huge part of the story when we hear what people have been through. Trauma and violence, we'll talk about that in a second, huge part of the story. Substance use, absolutely, addiction is part of the picture. However, as I said, for example, with youth, addiction is often part of the picture after people have already had a crisis. And that's because people find something that's going to help them feel a little bit better in that moment. If you're sleeping outside on the ground, and you can find something that's going to make you not feel pain for a little while, you're going to take it. Poverty, I painted the picture of poverty, absolutely. People just struggle to pay rent. And mental health challenges, again, mental health challenges sometimes being part of the pathway into homelessness, but being a huge risk factor once people are homeless, if those haven't already existed, that they start to come out. And so when I think of homelessness, I think of a series of unfortunate events. Because if you think about any one of these single factors, most people who experience that factor aren't homeless. So people say, well, homelessness, it's an addiction. It's people do drugs and so they lose their housing. Actually, the most people who use substances problematically are still housed. Right? So the addiction doesn't cause homelessness in and of itself. Same with mental illness. People say, oh, it's mental illness. You know, people on the streets, I've seen them. They're crazy. They're out of their minds. Of course they can't find somewhere to live. Again, the vast majority of people who have mental health challenges don't become homeless. It's when you get those compounding factors together. It's that series of events. It's poverty and mental illness and abuse and relationship breakdown and family crisis that all come together to cause that individual to be dehoused. Gabor Mate is a brilliant man, and he tells this in a way that's even far better and wiser than anyone else. Gabor is a physician. He comes out of Vancouver, and he works in the downtown east side in Vancouver, where we have kind of the biggest concentration of poverty, homelessness, and substance use in our country. His background is he grew up in a family of Jewish individuals, many of whom had lost relatives in the war, and he experienced neglect, abuse, violence in his childhood, in that context of all of that trauma, generational trauma, and has taken his experience of journeying through hurt, pain, and trauma and use that to now be compassionate to those who are also suffering. And so he works and he helps people who are homeless, dealing with their addictions. And he talks about pain. And he says homelessness, what causes homelessness? Pain causes homelessness, human pain. And so he says, a hurt is at the center of all addictive behaviors. The attempt to escape from pain is what creates more pain. And we should ask not why the addiction, but why the pain. And so he says in his work, he has never met a person who is homeless who has not experienced some form of trauma. And then through that trauma, people medicate, that medication becomes problematic, and they find themselves in addiction. Now there are also structural causes, because I don't want to say that this is all just about individuals and their families. I would also suggest that our history tells us that our policies, our systems design the type of homelessness that we see. This is federal spending on new affordable housing in Canada. Has anyone spotted a trend? Yeah. So, although after the reduction in the 80s, we did start to spend on new affordable housing, that has declined. Interestingly, that little blip there, that is our last recession, and that was the Harper government, also a conservative government, so same party as the Mulroney era, who have now understood that in difficult economic times, the government should actually spend more, which is using that money to keep the economy running, keep those jobs in place so that we can carry ourselves through the recession. So that's that uptick was the stimulus funding. And building new housing is great stimulus funding, by the way. Construction jobs, they're local, they're some of the more precarious work, and the money goes right into communities. So I would say that our systems also are a choice that we make on what homelessness looks like in our community. All right, so we've gone through a lot of history, a lot of stats, some stories. So, well, what the heck are we going to do about all this, right? So we still got a big problem. We still got, 2,000 people in London ending up in an emergency shelter. How do we solve this? So you're savvy individuals, you're connected, you're getting out and about, you're probably reading the news or keeping up with what's going on in the world. You may have heard about Utah or Medicine Hat. You might be hearing, someone's solved homelessness. Utah, they solved homelessness. Medicine Hat, they said they've got no more homelessness. What's going on here? What are they doing? Can we do that? What's that all about? So what that's about is that's a new model called Housing First. And this is actually a research-based model, so hooray, researchers, self-promotion, where they looked at the way that we were dealing with homelessness, which was a curative, fixing people model, which was, okay, you've got this crisis, you've become homeless, so now we're going to get you into some sort of treatment for your substance use or your mental health. And if you're compliant with your treatment, then we'll move you into like some temporary transitional housing. We'll teach you how to be a good tenant. And if that goes well, then we'll move you into more permanent housing. And so that idea was treatment first, like fix people and then get them into their permanent housing. But what they're finding is that it's really hard to fix your stuff when you've got no home. So when you're living in this chaos and this crisis of homelessness, you're going to miss your appointment with your psychologist. You're going to lose your medication. You're going to have trouble. And so they said, well, what about if we just gave people somewhere to live first? And then that can be like the foundation where they start to deal with their stuff. And so they actually were able to do that. In New York, they did a huge, it was not a randomized controlled trial, it was a natural controlled trial. So they offered people different options. People took the different options. Sure enough, what they found is that if people had some choice about what that housing was going to be, and they had some support in going into housing that they were successful. There was no preconditions. They didn't have to be trained how to live in a house, because most people haven't been homeless for that long. They know how to lock a door. And so if you just give people housing first, that they actually do a lot better. So that's what Medicine Hat has been doing. Now, Medicine Hat has an average of 60 individuals experiencing homelessness in any given year. So they are like, hey Dave, hey Mike, hey Sarah, what about we just get you into some housing, right? And so then they did, and it worked, and they solved homelessness. It's a little bit more complicated in London with 2,000 people. And so actually part of what we're doing in London right now is what we call our by name list, which is getting to know who these people are, where they've come from, what they need, so that we can get them as quickly as possible into housing. Utah is on that same journey. So as an entire state, they said this, we're going to shift. We're going to shift from just having all these emergency shelters where people get stuck and sick and die too young. We're going to move our resources into helping people get home, and home as quickly as possible, right? And wrap the supports around that, rather than trying to fix them while they're in the midst of a crisis and hope that they, somewhere down the line, qualify to get home. So good news is we're doing this in London. Some organizations you may be familiar with: London Cares, CMHA, Street Level Women at Risk, Unity Project, Streetscape, are all organizations in London who are providing this type of housing first model. So the model basically looks to find people who have been stuck in shelter for way too long and get them out into housing. Get them out of that shelter system, get them into housing, wrap the right supports around them so that they're successful there. Key pieces of the model to make it work. One is a rent subsidy. So remember that gap I showed you, the $230 gap between what people get in an income and what it actually costs to get rent? So you can't move people quickly out into housing if they literally don't have any money to pay for it, right? So one of the things that these programs do is they provide a rent subsidy which bridges that gap. So it's usually $200, $300, $350. That rent subsidy is paid direct to landlord. So that's a nice way to talk landlords into this. Right? Because when you're like, hey, we're a social organization that works with people with chronic addiction and mental illness, would you like to help us house people? The landlords are like, no. But we say, hey, your rent's getting paid direct to you. You're going to get your rent every month, no matter what happens. And we have a 24/7 call line with a mobile outreach worker. So if things go south, give us a call. We'll be there in an hour, and we'll help sort things out. Right? So noise complaints, or they're bringing in lots of strangers into the building, or they keep leaving the main apartment door blocked open so people can come and go, or all those sorts of things. Give us a call, we'll come in and we'll sort it out. And we'll help you, we'll help them, and we'll make this work. And then the last piece is that community support and integration, which is helping people find new communities and new ways of belonging. Because the other weird thing that happens with this type of work is that sometimes these outreach workers who run these programs have gone back into shelter and they found people who they're paying the rent direct to landlord back at the shelter. So they said, what are you doing here? Right? Like, we're paying for your apartment. What's going on? And so part of that is that people, if they aren't supported to find a new community, they feel lonely. Right? Because the nice thing about the shelter is you go down for your breakfast and your dinner, and there's a cafeteria, and there's the people you know. Right? And so if that's what the people are that you know, then sometimes you leave to be with those people. So that's the last thing that they do, is they try to help them find ways to connect with those same people, or to also connect with new people so that they can stay home and they can belong and not be lonely. So we've done some research out of Lawson Health Research. Dr. Cheryl Forchuk was the lead on this. And we were able to track individuals and their experiences with one of these programs called London Cares. Great thing about Ontario is we have a huge database of information. This individual was visiting an emergency room on average 14 nights out of a month. entered this program at the end of August, stopped going to the emergency room, except for when he had a real crisis, because he had a lot of health issues going on. And so what we were seeing was emergency room utilization, police contacts, shelter stays, all declined precipitously, meaning that we were spending a lot of money to house people, but we were saving way more than we were actually spending on keeping them in this crisis in the first place. So this, I'm not going to talk about that because it saves a ton of money. Jail's way more expensive, hospital's way more expensive, shelters are way more expensive. It actually just costs less money to put people directly into housing and give them the supports they need to stay there. So, to conclude, what about preventing people from getting homeless in the first place? Because that's my thing about Housing First, is great. Let's keep doing that and helping people who are homeless find home, but what about stopping them from being homeless in the first place? So homelessness is complex. It's what they call a fusion policy issue. I think that terminology was made to keep folks like myself employed. But basically what it means is that it's not just a housing issue, right? It's a health issue, it's a social challenge, it's education, it's violence, it's all sorts of things that connect together to create this challenge. So is it unsolvable because it's so complex? No, I don't think so. At least if I did think that, I wouldn't be coming to work every day. So I think we can solve this, and I think we can use public health, I'm a nurse, to help us solve this. In public health, they talk about different orders of prevention. So what I want to do is I want to talk about those different levels of prevention as they pertain to homelessness. So don't worry about reading everything in the graph. Basically, this is just how public health says there are different ways to prevent illness, disease, risk in a community rather than just treating diseases after they happen. So primordial prevention is systems, policies. Are there policies that we can change that are the policies that are causing people to become homeless? Like things about our unemployment insurance. We heard a lot of stresses about that in the last recession, that those were insufficient. Are there policies around substance use that we can create better access to care before people get into crisis? How do we stop jail being a pathway into homelessness? Because it is, we're release people from jail into homelessness. Why not support them? Well, we have them as a captive audience to provide the support so that they leave into housing, right? So let's look at the systems that are part of the problem. Primary prevention is the same as primordial, preventing before it happens, but at that individual level. So how can we support individuals and families who are in crisis before that crisis becomes homelessness? This is a project out of the family shelter in London, where they've created basically a phone helpline. Because families don't tend to just show up at shelter. Individuals do, families don't. Families usually call ahead because you're dragging your kids around, you don't want to get there and find out it's full. And so they have a team now when that phone call happens that they say, okay, we're going to come out to where you are and we're going to help you and see if we can prevent this thing from happening. 90% of the families who they diverted from that have remained housed 18 months later. So that's it. So say months. 18 months later, remained housed. So it's working. Secondary prevention is once people hit shelter, let's get them out of here as quickly as possible. They're using this a lot for youth because youth shelter outcomes are particularly poor over time. These are some of the youth outcomes: poor health, poor self-confidence, disconnected from education. So let's help youth get into housing. And so many youth, they've never had a rental agreement, they've never had income, those sorts of things. So there's a little bit of work that needs to be done to help youth get housed quickly. So I told you about Housing First already. This is what it is. That's tertiary prevention. That's like, this thing has already happened. How do we get people out of it? Which is great, we need to keep doing that, but we need to do more of the upstream stuff. And then lastly, quaternary prevention. This is a new kind of concept, which is the idea that being in systems can create their own particular harms to people. Labeling someone as homeless, getting people stuck in this pattern of being homeless can actually have its own negative effects. So quaternary prevention is making sure that our system isn't actually messing people up, and that we ensure that we don't have parts in our system that actually make it harder for people to become independent again and become rehas. So those are the 5 levels of prevention. So what can we do about homelessness yourself? This is my final slide. I see Bob getting antsy. You can be a good neighbor. People need to live in communities. These are difficult people. They often are people who are having mental health challenges, who are having substance use challenges. If we only see people as problems, as neighbors, then we will push them out of our neighborhoods, we'll push them into homelessness. So be a kind and a compassionate neighbor. Reach out to support to help people rather than pushing them out of your neighborhood. Be a donor. So things like London Community Foundation is building new affordable housing. That's a great way that you can support financially to create real solutions. Be a voice of reason. The narrative around homelessness, sometimes I make the mistake of reading the letters to the editor in the Free Press. It's really depressing, right? People lose the sense of humanity. They don't see that homeless person as a person anymore, and they just want to get rid of them, right? We can be more intelligent than that. It's not about getting rid of people, it's about helping people. And lastly, be a volunteer. Those things like emergency shelters, food programs, food banks, they are that landing place. We need that crisis support. Those are a great place for you to spend your time to help folks out. And together, absolutely, we can solve homelessness. It's going to take a lot of work, but we can do it. Thank you very much.